simplifying a complex, confusing world. The Explainers, only on The Podcaster.
Imagine walking into a clinic and seeing this poster displayed proudly on one of the shelves. It's a pledge by a group of doctors to reduce the number of antibiotics they prescribe. Now, I'm not sure how comfortable I feel with the idea of a doctor having an epiphany about medicine, because if you don't trust the medication you're prescribing, why do I even need you? Antimicrobial resistance, or AMR, is now a problem that's so serious that doctors want to wean people off antibiotics. This issue is serious enough that the Indian government has something called the National Action Plan on Antimicrobial Resistance. Welcome to the Explainers on the Podcaster. But right here on this episode, we're going to dive into an unusual and sobering subject, the growing problem of antimicrobial resistance due to rampant antibiotic abuse and how it is already affecting people around the world. The United Nations even labels it as a crisis, and the WHO places AMR in the top 10 global public health threats facing humanity. So, you know why this podcast is important.
We help you understand the world. The Explainers, only on The Podcaster.
Overprescription, self-medication, and evolving superbugs. It is estimated that around 1.27 million people lost their life in 2019 due to AMR. Around 5 million people die across the world every year, directly or indirectly, due to this growing problem that is antimicrobial resistance. Now, that's more than the number of people who succumb to HIV or AIDS or malaria worldwide. AMR happens when common microbes no longer respond to the medications we use to treat them. It develops through a process of natural selection. When we use antibiotics or other antimicrobials, we're essentially creating a selection pressure. Most of the microbes are killed, but those with genetic mutations that confer resistance can survive and multiply. And over time, these resistant strains become more common. This process is accelerated by factors like inappropriate use of antimicrobials, incomplete courses of treatment, and overuse in agriculture. AMR pathogens, the official title for superbugs, are evolving due to the misuse and overuse of antibiotics that don't actually treat the problem. So, the next time you pop an azithromycin to sledgehammer that viral fever, you're probably helping create a superbug. Antibiotics don't actually work on viruses, but you already know that and will likely take it anyway, which please don't. Now, according to experts, out in the general population, these bugs take about 2 to 3 years to adapt and become resistant to antibiotics. In lab experiments, that happens in just 11 days. Leslie Ogilvy of the German Center for Infection Research told DW News earlier this year, if we don't attack the AMR problem now, we'll have a post-antibacterial era by 2050. The immediate problem is that we're now seeing children born with bacteria that are resistant to antibiotics. According to Raji Tajuddin, Deputy Director General, Africa CDC, Africa has the highest mortality rate linked to AMR, that is 27.3 per 100,000. He said mortality related to AMR exceeds the combined toll from HIV/AIDS, tuberculosis, and malaria. Now, in one study in Nigeria, and I'm going to quote here, samples taken from mothers and newborn babies younger than 1 week in Nigeria already had colistin-resistant bacteria present in their bodies, but neither the babies nor their mothers had been treated with colistin. Colistin is one of the last remaining antibiotics that is still effective in killing bacteria and fighting infections, such as it is deemed critically important for human medicine by the World Health Organization. Unquote. But colistin is rarely used in hospitals and clinics in Nigeria. Another report in Australia this year claimed that 1 out of every 10 children with a bloodstream infection are infected with a multi-drug resistant organism. That means 9.4% of the bacteria causing bloodstream infections were multi-drug resistant. In India, the Union Ministry of Health and Family Welfare released a report this year that said that around 47% of prescribed antibiotics, and we quote, fall into a category of drugs with a high potential for AMR or antimicrobial resistance that generally have to be monitored for misuse, unquote. Now, the study included over 9,000 patients and 12,000 antibiotic prescriptions and found that 55% of the patients were prescribed antibiotics as a preventive. Only 45% were prescribed antibiotics to actually treat infections, and just 6% of those were prescribed the drugs after identifying the specific bacteria. Scary, right? Now, the health ministry official stated that doctors in medical colleges are to mandatorily mention the exact indication or reason or justification while prescribing antimicrobials. Why? That mortality rate that I spoke of, you remember that? 27.3 in Africa. That rate is 21.3 for South Asia. So, we in India are not insulated from the fallout. In fact, India leads the world in human antibiotic use. I mean, you know this, right? Because we've all had that family doctor who's nonchalantly written out a prescription for a 3 to 5 day antibiotic course every time that you felt mildly ill. Well, the consequences of that are here, and today's doctors are making pledges now to cut back on handing out antibiotics so that these medicines do not become entirely ineffective. There are second-order effects as well. Drug-resistant pathogens threaten the ability to treat common infections and to perform life-saving procedures including cancer chemotherapy and caesarean section, hip replacements, organ transplantation, and other surgeries, according to the WHO. Developing antibiotics is hard. So, you're asking, what's the big deal? We can always make new antibiotics and new antimicrobials, right? Well, Big Pharma has billions upon billions of dollars stashed away, as well as massive transnational R&D facilities and workforces. That's what you're thinking. Well, the thing is, no new antibiotics have been developed for 60 years now. You see, it's pretty hard to develop new antibiotics. The first antibiotic, penicillin, was developed nearly 100 years ago in 1928. And today we have hundreds of types of antibiotics, but no new antibiotics have been discovered since the 1980s. Every new antibiotic basically is a variant of what's already available. And by some estimates, it can take 10 to 15 years and over $1 billion to develop a new antibiotic. Now, there's not enough money in it, so most pharma companies do not spend time or resources on antibiotic research. And it might take up to a decade, they say, until new antimicrobials are ready for widespread use. Fortunately, here comes Iftikhar in the Jeep to save us all, the last moment. Not really the last moment, hopefully not. Hopefully we have plenty of time to crack this. But we may have found an ally in AI. That's my Iftikhar, by the way. Now, according to MIT, and I'm going to quote here, using a type of artificial intelligence known as deep learning, MIT researchers discovered a class of compounds that can kill a drug-resistant bacterium, drug-resistant Staphylococcus aureus, or MRSA, which accounts for thousands of deaths worldwide. That makes it the first new class of antibiotics developed in 60 years. That's correct. But the overall problem is not mitigated. And to put it simply, every time you take or give your child an antibiotic unnecessarily or improperly, you increase the chance of developing medicine-resistant bacteria. If you want a slightly more humorous side effect, well, according to Healthline, antibiotics are increasing cases of untreatable gonorrhea. While humorous for everyone that doesn't have the clap, that I should say here.
We help you understand the world. The Explainers, only on The Podcast.
Antibiotics everywhere. Now here's an interesting fact. More antibiotics are prescribed to animals than to humans, and this is done to prevent infections or promote faster growth in animals. Back in 2016, mobile colistin genes were found in E. coli bacteria from a pig farm in China. Now, those genes carry resistance to the antibiotic colistin and can spread between bacteria, furthering colistin resistance. As a result, China imposed a complete total ban on colistin's agricultural use. One extensive study in 2018 concluded that consuming foodstuff that contains antibiotics can cause, and I'll quote here, direct toxicity, the development and emergence of antibiotic-resistant strains of bacteria, as well as therapeutic failure in clinical cases, unquote. By some estimates, approximately 100,000 tons of antibiotics were used around the world to raise cattle, sheep, chickens and pigs in just 2022. That number could go up by as much as 8% by 2030. Which, by the way, is just a few years away. Now, the WHO also makes another interesting claim. And I'll quote here again, the misuse of antibiotics during COVID-19 could lead to accelerated emergence and spread of antimicrobial resistance. Antibiotics should not be used to treat viral infections unless bacterial infections are also present, unquote. In the case of India, the $41 billion pharma sector has played a role as well. Ramanan Lakshminarayanan, director for the Center for Disease Dynamics, Economics and Policy in Washington, D.C., told Nature magazine, and we quote, "There's so much competition in the antibiotic space that there's aggressive pressure to sell antibiotics. The incentives there are to hugely oversell antibiotics, and not any antibiotic. It's to oversell the newest antibiotics, which really shouldn't be given to people just willy-nilly. But that's what's happening," unquote. It's clear that the government of India is in agreement with such an assessment, given its mandate holding doctors and medical colleges accountable for antibiotic prescriptions. And then in India, we also have to contend with the rise of multi-drug-resistant tuberculosis, or MDR-TB. According to the Ministry of Health and Family Welfare, India has the highest burden of MDR-TB in the world, with nearly 150,000 new cases every year. Treating MDR-TB is extremely challenging, requiring a longer course of more toxic and expensive drugs, and even then, the cure rate is much lower than for regular TB. Lax quality control is also a major concern. In 2017, a study published in The Lancet found that around 10% of antibiotics in India were of poor quality, meaning they did not have enough active ingredients to kill bacteria effectively. Such substandard treatment fails to cure infections and promotes the development of resistance. Another critical area is public education. People need to understand that antibiotics aren't a cure-all and that taking them unnecessarily contributes to resistance. Simple steps like completing the full course of antibiotics, and we've heard this from, I think, when we were children, even if you feel better, can make a huge difference. Huge. And that's where the doctor's pledge can begin to make a difference. Similar initiatives are springing up around the country and the world. In Tamil Nadu, a comprehensive surveillance program has been implemented in hospitals to track antibiotic use and resistance patterns. Solutions to AMR involve a multifaceted approach, improving stewardship, reducing agricultural use, investing in new treatments, and promoting responsible antibiotic use among the public. In short, stop taking so many damn antibiotics, you guys. Well, that's all for this episode of The Explainers. We'll see you in the next one. Take care.
We help you understand the world. The Explainers, only on The Podcaster.